have a patient of primary hyperparathyroidism or hyperparathyroidism, we have two options. Either you go for a medical management or you go for a surgical management. Remember, surgical management is the preferred treatment. Now, when we talk about the medical management, now you need to ask to yourself that are you dealing with a simple case of hyperparathyroidism or you are dealing with hyperparathyroidism with hypercalcemic crisis. Because if it is a hypercalcemic crisis, first of all, what is hypercalcemic crisis? Serum levels beyond 12.5 mg per dl, or there is something which is known as critical hypercalcemia more than 16 mg per dl. Now, mortality is so high in these cases. The first thing is that the muscles are under spasm. So you need to go for the adequate hydration strategy. So adequate hydration with aggressive saline infusion, more than 200 to 500 ml of normal saline per hour, and this is going to increase the calciuresis. Once you get the target output of 100 to 200 ml per hour, the next is now you introduce the loop diuretics like furosemide, etc. And now once the patient is controlled, start the management of hyperparathyroidism. So either you can go for surgery or you can go for medical management. Now, medical management, we have pyrophosphates like bisphosphonates. They can be given IV in case of crisis or orally. Now, they decrease osteoclast activity, hence improves the bone strength. Then we have denosumab, which is a rank ligand inhibitor. Again, it decreases the osteoclast activity. Now the third is calcimimetic agents. So we have sinacalcet or PTY30, which mimics like a calcium, acts and stimulates the CASR, calcium ion sensing receptors, and which in turn are inhibitory to the gland. They are the most useful mechanism used in case of secondary hyperparathyroidism, because that is where the gland is absolutely normal. The next is you may introduce calcitonin, that again increases the calciuresis and decreases the osteoclast activity. And to prolong the effect of the calcitonin, we also use the steroids. Next is, let us talk about the surgery.